Mental illness is a major problem in Kenya. It is estimated that 1 in 4 people suffer from a mental health condition. Due to low awareness, stigma and discrimination, the condition is still prevalent in the country, a situation that is further complicated by an acute shortage of professional mental health specialists such as psychologists and psychiatrists.
Matters mental health, at times they are usually lost in the wilderness of non-communicable diseases. So we forget that mental health is also a big issue that needs to be advocated, needs attention, needs funding, and needs a voice. Nyeri is one of the fortunate counties that has 3 consultant psychiatrists. Not many counties in this country have that kind of. So we have these consultant psychiatrists, and they have also been very supportive on that linkages between the hospitals and the community.
The Problem Management Plus model is a simple, scalable psychological intervention used to treat the global mental health disease. And it is designed specifically to be delivered by community health volunteers who are minimally trained, and they are also supervised on a weekly basis. One of the counties where we implemented PM Plus was Nyeri County. And one of the reasons why we went to Nyeri, it was because of a high number of gender-based violence cases.
Over 1,500 community health volunteers have been trained by World Vision on Problem Management Plus in Nyamira, Nyeri, Nakuru and Nairobi counties. In return, more than 6,000 men and women have also benefited from the Community Health Volunteers service, and this has helped to improve the well-being of their families and children. This has been done through funding from World Vision, Grand Challenges Canada, the Canadian government, the World Bank and Wellspring Advisors.
As a master trainer, I was trained, so now we went ahead and we trained the TOTs. You could read one Saturday in class, then under supervision it will be done. For example, the first strategy was we do what we call stress management, managing stress. There is where you have somebody has problems, somebody has a lot of stress, then you are shown how to do some breathing exercises such that when they do that, they'll feel that they have relieved some stress. From there, we had now what we call managing problems, which involved around 7 steps. That you have to go with this person, let the problem come from this person, list all the problems. After listing all the problems, try and choose the most solvable problem, because some problems might not be solvable. From there, we went somewhere, another strategy called get going, keep doing. In this is where you find that when somebody is undergoing a lot of stresses, you find you are even forgetting on the things you used to do. So in this step is where you try to awaken the things that this person used to do, and you start redoing it slowly. So from there, we had what we call the strength and social support. We all know that if we leave this person the way this person is, chances of going back to the stressful things or to the depressed mood are very high. Let this person tell you, where does this person think that he can get the social support from? Ideally, we could say that if it's possible, we have a family member, because that's where a good social support can come from. But you might find somebody who the source of the problems is the family members. So you can tell to ask this person, where else do you think you can get? Some will tell you from the churches, from the social groups. So you don't necessarily decide where this person you get the social support from.
Problem Management Plus was a program by the World Vision. They trained me for 2 weeks. Then after that, I became a trainer. So I trained community health volunteers whom we have been working with in the community. The CHVs, they are community health volunteers, so they are basically in touch with the community because they do household visits. So when they go to those household visits, they can identify people that are affected by stress. So it was very important to train the community health volunteers, and actually they have helped a lot of people who maybe would have developed mental illness. After the training, World Vision came in and supported our community health volunteers and bought pigs for them. So they have an income generating activity, and the money they get from selling those pigs, they do table banking. It has really helped the community health volunteers to stick together.
World Vision Kenya, in partnership with the Ministry of Health, has been training community health volunteers on how to address common mental health problems such as depression, anxiety, and chronic stress. This new approach helps people to self-manage mental problems arising from life challenges such as unemployment, conflict, violence and relationship issues.
Problem Management Plus nilisikia through my PHO, akaniita kwa seminar, nikaenda Karatina nikasoma, ndio sasa mimi nikakuja ndio nisaidie my community. Ndio sasa kama watu wale walikuwa na shida, hiyo shida sasa wengine tulikuwa tuna manage nao, mimi naenda kwa client, naenda kama niyo session tulikuwa tumeambiwa ya kwanza, ya pili, hivyo hivyo, ndio sasa watu wana recover. Wale hawakuwa na recover, wengine tulikuwa tunafanya bidii ndio waende rehab.
I was in an abusive marriage. I had an assist for a husband, so I could I was apologizing for everything and anything, even if I have not done anything. I felt guilt every time. He tried to commit suicide, kill us every time, and I was so afraid of everything and everyone. And you know, in the community that we are, the wife is supposed to be, you are supposed to be the good wife. I was that beautiful woman. You could see a beautiful picture, but inside it was broken into pieces. I wasn't there. In fact, it wasn't good. In fact, it's very rare to see me stressed now. Whatever I can change, I don't deal with it. I don't struggle with issues that they are beyond me. But the keep doing, get going strategy helped me, because I'm now working. I go to church now. I go to social places. I couldn't go to clouds for more than 10 minutes, but now I can go comfortably.
We had several success stories of either persons who had been identified in the community by this group. We had some CBOs done just to ensure that there's some sort of income generating activity for community health volunteers, which was also something that was a very unique direction in terms of just seeing the sustainability of some of these programs.
Hii mradi tuko nayo, ile imetufungulia njia ni mzinga. Wakati ule tulipewa na World Vision, sasa ndio tukawa na nguvu. Tukaanza na hiyo mzinga moja, katupatia asali, tukauza. Tukiuza asali inatusaidia, tunapata pesa, tunanunua hizo mzinga, tunafanya table banking, tunaenda hata kuona hao wagonjwa, wakongwe, hata sisi wenyewe tunajisaidia nao.
One of the successes of this project in Nyeri, we have seen that gender-based violence has been able to reduce because community health volunteers who work in the communities are able to identify that, and they are able to offer the PM Plus to individuals who have issues to do with gender-based violence, and they are also able to refer appropriately. Also, common mental health problems have been able to reduce in Nyeri because the community health volunteers are working closely with the health facilities, and they are able to identify and offer the intervention both in the communities, and also sometimes they are called upon from the health centers to be able to get clients and deliver the intervention to them.
With Problem Management Plus, families have become more empowered to manage and prevent mental illness due to the support offered by the trained and supervised community health volunteers. As a result, the Ministry of Health has adopted the Problem Management Plus model and is scaling it up so as to enhance access to mental health services in the country.